Um, welcome, and thank you so much for spending a few minutes here with me today. I'm excited to jump on here and kind of share a little bit with all of you guys. I got this idea because, sometimes I'll get general questions about what is it that I do? Why is it different from quote unquote conventional dentistry? What's holistic mean? That's a buzzword. It's trending now. Everybody wants to say it. But what does it really mean? And so I thought it would be a good idea to come and share my perspective of it. And again, the disclaimer is this is my perspective, right? Based off of my experiences and my understanding of what I believe the subject matter to be, it is by no means meant to indicate that this is the only way to practice dentistry or understand it or interpret it. It is not meant to poo-poo on other people who do it differently. But life is enjoyable when you have like-minded people, and someone who appreciates kind of the traditional things. They deserve better than a dentist like me telling them all of this garbage, right? But I wanted to put together something. So I put together this presentation called 7 Ways Your Biological Dentist is Dedicated to Your Overall Health. That title is a mouthful. You guys don't want to hear what the other title options I had going were. But again, this is intended to spark some dialogue and empower you guys. Making dental decisions is difficult nowadays, but the benefit and the curse is that we've got a lot of information online. Sometimes it's a little bit difficult to decipher what's what. All right, so let's jump right in there. Quickly, a little bit about me. I was born in Nigeria. People always ask me, what kind of name is Udoka? And then you got the Holinbeck going, and it's confusing. But I was born in Nigeria, raised in North Carolina. I went to undergrad in North Carolina, and then I went all the way to Los Angeles for dental school, received my Doctor of Dental Surgery out in Los Angeles, practiced for Houston for some time, have been practicing in Pewaukee since about 2015, 2016. And since getting out of school, I've been dedicated to continuing education. It's so fascinating and amazing to be in a field that's so dynamic. It's constantly changing, constantly evolving. And it's really, really cool to stay abreast of all of these things. So in that light, I've been pursuing my fellowship with the Academy of General Dentistry. So that's given me an opportunity to learn as much as I can as well. Additionally, I'm a member of the IOMT. So the reason I mention this is because it's relevant to the subject matter we'll discuss today. I'd say the IOMT is one of the leading authorities on biological dentistry. It stands for the International Academy of Oral Medicine and Toxicology. And so it's a research-based organization that is very known for its position papers on fluoride and mercury. And they're a leading authority, not based off of anecdotal evidence, but actual research-based results. So it's a great resource for me to draw upon when I'm making decisions about how I want to practice. So outside of all of that, most importantly, I am a wife to my best friend of 11 years. That's Bradley. He's a sweetheart. And both of us are parents to these two knuckleheads, right? These two are the reason that I've gotten into all of this. And not to say that you need to have kids to be motivated. That's ridiculous. But for me and my journey, it really started to get very serious when my first one was born. Having some GI things going on, it started making me much more aware of my environment, of his health, my health even. The little one and his adenoids have been putting us through some things as well. And as you know, there's a big correlation between sleep and dentistry nowadays. But these two kids are essentially what motivates me to want to know more, as I'm sure that some of you can relate to. All right. And my other why is this. This is pretty random. Someone posted this on one of my Facebook forums, and it's an ad for cigarettes. And it's just in the 50s. Like, that's not that long ago. And here we're convincing the general public that the people that care about our health the most and know the most about health, they're smoking cigarettes. So it's all good. It's all good. Smoke, have a good time. And, during that time, there were some detractors who were like, cigarette smoking is not great. We probably shouldn't do it. But they were squashed down by the bigwigs, right? The people that were economically in charge. So this to me hits home because while some holistic things are starting to become trendy, there's some very fundamental things that right now are being battled on the legislative level. And I'm curious of all those things, for example, some controversial things like fluoride in the water, for one example, I wonder how many of those things will turn into something like this, where my kid is looking at an ad from, this time and saying, wow, can you believe that they did that? But this is encouraging because it reminds me that we're constantly, as a society, we should be constantly evolving and our ideas should be growing and changing. And that's not a bad thing. And that's not anything to be ashamed of. All right. So jumping in to today's presentation, I'm going to try to answer a few questions for you. One, I get asked, what's the difference between holistic, biological, integrative? Well, the differences are subtle. They go together, but there are some things definition-wise if we want to get into semantics, and I'll explain all of that to you. Can teeth actually heal themselves? Okay, let's find that out. What exactly is ozone oxygen therapy? What are some metal-free alternatives in dentistry? And what's the real issue with root canal therapy? All right. And as I'm doing this, if you guys have any questions, just shoot it in the chat box. If I happen to see it on the right there, I'll answer it as I'm going along. Otherwise, it's something we can answer at the very end of the presentation or maybe later on in a Facebook post or something like that. Okay, so don't hold back. Awesome. So number one of the 7 ways your biological dentist is dedicated to your overall health is listening. So this is not limited to a biological dentist. This is any dentist or any provider, period. A lot of concern that my patients have brought to me in the past is, I just don't feel heard, I don't feel listened to. Now, the reason I resonate with it so much as a biological dentist is that a lot of my patients have gone through or are currently going through a medical journey. And so they have more to tell, right? And so sometimes it can be difficult to listen to all that and you feel like it's noise because it's outside of whatever you were trained in, coming from a practitioner's standpoint. But as a patient and you're sitting in that chair, you should feel listened to. And if you at any point feel like you're not, it's not you, it's us. We have to do a better job of listening. So your practitioner, in order to better help you, in order to better prioritize your health, should want to hear your concerns, should want to know your experiences, and should want to really understand your symptoms in a non-judgmental way, in a way that shows some compassion, right? So that's important to throw out there, just in general, all right? Number 1, easy, done. All right, let's go to number 2, education. So when you see this slide, you're probably thinking, okay, yeah, my practitioner should be trained and educated, and so that's valid, yeah. And don't ever be ashamed to want to know, hey, what's your training on all of this that you're mentioning here? What experiences do you have? Because all ego aside, your health is the priority. So for me personally, if I'm not up for doing X, Y, and Z, then we should know that and we should find you someone who can do X, Y, and Z, because at the end of the day, it's not about me, it's about you and your total health. So yes, the practitioner's training is important and it should be a candid conversation without anybody's ego being bruised. But more importantly, I think sometimes it's your own education, right? It's not going to be possible for me to explain in 30 minutes to you everything that it took me 12 years to learn, right? But there should be that intent of wanting to provide you with the tools so that you can make an informed decision. I don't know if you guys can hear all that stomping above me. It's my children. Sorry. I thought I'd come down to the basement and have a quiet time to talk to you guys, but these people are insane. Anyway, so providing you with the tools to essentially make the informed decision is important. And if I can't sit there and explain all of that to you right then and there, I should be able to guide you. Like, what are the resources? What's a website? What's a book? Maybe type up some things. But long gone are the days where it's like, well, I'm saying that this is the way we should do it, and that's that. No, you deserve to understand that process that has led you to where you are. In fact, you're going to be more keen or more motivated to pursue treatment and be into it and therefore heal better if you have a better understanding of it. So your education, your knowledge, you're in the driver's seat of your own health. All right, number 3. Now we're getting into some nitty-gritty stuff. We're going to be on this slide for a little bit. Respecting the body's ability to heal, right? This is important because when you're wanting to approach healthcare in a total body philosophy, you have to understand that the body does have ability to heal. Otherwise, we'd all be dead, right? This same philosophy applies to the teeth, but it's not exactly the same. So whereas you can get a paper cut on your finger, you really don't need to do much, and then it heals. Maybe you want to wash your finger, get the germs out, but it really heals without you having to do much. So the teeth do have a capacity to heal. It just takes it takes more effort than I think that we are aware of, right? So it begs the question, can teeth remineralize? And I get this question asked to me a lot. So before I can fully answer that, let's dive in a little bit to how cavities start in the first place, right? How do you get to the point where you even need things to remineralize? How did you get that breakdown in enamel in the first place? Well, multiple things happen when a cavity is being formed. One, you've got to have the right kind of bacteria. We've got bacteria going through all of our bodies and a whole bunch in our mouths. Some of them good, some of them bad, right? But there's a certain class of bacteria that are cavity-causing bacteria. And you have to have a good enough amount of those to carry through the process of getting a cavity. The second thing you have to have is a food source for that bacteria. The same way all of us eat and drink and then we pee and poop, bacteria does the exact same thing. So that food source for bacteria is oftentimes carbohydrates and sugars. It doesn't always have to be lollipops. It can just be anything that's got some kind of carbs capacity, and sometimes even non-carbs too. Whatever you're eating, that bacteria is going to eat. But the more sugars, the more carbs, the more of that cavity causing bacteria can thrive. Now they got a lot to eat, right? They got a lot to eat, they got a lot to poop, and their poop, so to speak, is acid. So that acid gets released onto that tooth structure and it breaks down that tooth structure. So the other factor to consider too is your actual tooth structure. What's your enamel like? How dense is it? How porous is it? What's the composition of calcium and all those other minerals in your enamel? Do you have a lot of grooves? Do you have a lot of pits where bacteria can burrow and be hidden away from your toothbrush and your mouthwash? That enamel and that tooth structure plays a role. Also plays a role is the saliva. Saliva has a composition that in and of itself will remineralize your teeth. It's got minerals in there that do that, but it has to maintain a certain pH, right? So what is your pH level like in your saliva? Is it acidic? If it's acidic, you're going to get breakdown a lot quicker. There are medications that can cause changes in your saliva quality. There are certain hormonal things, radiation therapy. So the whole salivary thing. And then there's nutrition. How well are you absorbing certain nutrients? And now that gets into gut health, right? Are you getting the vitamin A? Maybe you're eating well, but is your body absorbing that vitamin A? Is it absorbing the vitamin D, which is so critical for the health of your teeth, right? Is it putting all of those elements together and utilizing it, distributing it to the rest of the body? So there's so many different factors that go into how teeth break down. Oh, and then there's the basics, right? Flossing and brushing and all that jazz. So all of those things play a role in how a cavity is formed. So then it makes sense that they all play a role in how teeth remineralize. So if you can see where I'm going, if you've got all of those mechanisms going on to break down the tooth, you have to address those mechanisms, especially those that are broken down if you want to remineralize. So it's not just as simple as, okay, the tooth is breaking down, I don't want a filling, I'm just going to floss more. Okay, well, hopefully that helps, but what about all those other mechanisms that are going on? And that's where that whole holistic thinking plays a role. So if we're wanting to exercise the body's ability to heal, we have to respect that whole system. And then that's okay. But we can take a look at everything from a total body standpoint. And if we don't want to drill on everything, that's perfectly acceptable. But we can look into nutrition, we can look into diet, we can look into pH, we can look at all those factors to see why you got the cavity in the first place and what we can modify. So it's a very long-winded answer, but hopefully it gives you a better perspective of the whole tooth remineralization thing. It's possible. Totally have seen it happen. But it takes a little bit of work. All right. And on the same topic of remineralization, what about fluoride? Is that your only option? Well, no. Everything I explained to you are options. For some of you that don't know, fluoride has been deemed a neurotoxin, right? So that doesn't mean that everyone that uses fluoride is going to have damaging effects, but there are people who are more susceptible to some issues when it has to do with fluoride. If you've got some thyroid things going on, or autoimmune things going on, or neurological things going on. And so I completely respect that with people. Fluoride in the water that's a tough one for me to get on board with, but there are some people who want to use just a little bit of fluoride here and there, and there's people who don't want to use any fluoride at all. In my office, we don't use any fluoride at all, right? Because there are ways to get there. Is it easier to slap some fluoride on your teeth? Maybe. Does it work? It actually does. The mechanism of action makes sense. But sometimes it's hard to reconcile, especially in a world where we're receiving all kinds of toxicity, right? Everywhere we go, there's BPA, and don't put the plastic in the microwave, and we got radiation from this, and toxic things and chemicals in our food and all of that, right? So it's all cumulative. So if you're living a lifestyle in which you want to minimize those toxins, I have a lot of people who say, whatever, we'll skip the fluoride, let's come up with other ways, and that's totally okay. Why not try that? All right, so that brings us to root canal therapy, and if teeth can remineralize in lieu of root canal therapy. So before I answer that, let's take a look at this slide here. See if I can kind of explain to you and show you a diagram. If you look at the middle tooth, you can see that decay that gets really close to the pulp, right? Inside the middle, can you guys see the cursor? My mouse, or moving around? No? Okay. Thank you. All right, so I'll try to be more descriptive with my words then. So right now, if you draw your attention to the middle tooth, you can see that decay kind of traveling down into the middle of the tooth. The anatomy that you see in the middle of the tooth is your pulp canal and pulp chamber. Inside that canal and chamber, you have nerves and blood vessels, right? The infection of those nerves and blood vessels, infection with bacteria, is oftentimes the reason for needing to pursue root canal therapy. Now, there's a growing number of practitioners that are implementing what's called regenerative endodontics, where they are exercising the tooth's ability to heal. They're exercising that trait in lieu of doing a root canal therapy. So when the nerves are in that inner part of the tooth, when that's vital, when it's alive, because see, nothing on our body is going to heal if there's not blood flow. There needs to be a blood flow, carrying oxygen-rich cells to that site to heal. In a tooth, if that blood flow is lost, that tooth has zero chance of healing. It will not work. It has to come out, or root canal if that's your thing. So in that scenario, you really don't have a lot of options. But in the scenario where the tooth is vital, and because you're like, oh, it really hurts with cold. If it's hurting, that's great. It's vital. So long as there's not an infection or that cavity is not bombed out the whole tooth, there are some chances, given the right practices, and it involves laser therapies and ozone oxygen therapies and all of that. In fact, I went to a session just last weekend, where the endodontist just gave an incredible presentation on this exact topic. So even in the capacity of, traditionally when the cavity gets close to the nerves, like that middle picture shows, it was the traditional thought to just go ahead and do the root canal, because you know what, you do the filling, then the tooth is going to hurt, just do the root canal. But now we're understanding that there are pros and cons to doing a root canal. And when it's not done properly, the consequence is it can be pretty traumatic, right? So the body's ability to heal is not limited to just a tiny little decalcification. We can get healing, especially in that nerve tissue, through some intentional regeneration, right? So while we're on the topic of root canals, that is a controversial issue. I know a lot of people have seen the movie Root Cause before it was banned on Netflix. And in that movie, their stance against root canals had a lot to do with the energetic pathways, the meridians and all of that, which some people believe in, some people don't. I mean, to me, it's not really that far-fetched, because I can connect it with the limbic system, and the idea that one tooth is connected to a different part of the body. But the biggest concern that I see clinically with it is the propensity to leave a lot of microbes behind, right? So when we're looking at teeth and thinking about teeth, what we see is this three-dimensional, or what's there is this three-dimensional rendering that you see at the top of the slide. But that's not always what we see, right? So you can notice how the canals, they don't just go up and down vertically. They go side to side, lateral. I mean, it's just a whole big network, intricate three-dimensional network. And that's very challenging to clean. So when we're not careful about really disinfecting that inside of that tooth, yeah, maybe it looks really good and on the x-ray, and you think it's fine, patient's out of pain. But if that bacteria remains, what we've done now is mummified and trapped it in that area inside a tooth that doesn't have the capacity to heal, right? There's no blood running through it. So those cells that would normally come in and eat up the bad bacteria and release an immune process that would help that area heal, that doesn't exist. So the body essentially is held captive. It's like you've got your arms behind your back and someone's punching you in the face. You can't defend yourself. That's essentially what happens in a root canal tooth that's not properly cleaned out. The nerves are gone, the blood supply is gone. It can't defend itself, but there's all that bacteria. So then you start to get like a longstanding chronic infection in that area. And so many people say, man, I had this root canal, and it was 15 years ago. It just never felt right. It's bothering me. And when I push it, it hurts. Just that kind of low grade. I mean, it bothers me, but is it enough? Is it in my head? What do I do? Right now with 3D CBCT imaging, we can see that bone that doesn't ever heal around that tooth. But before we weren't able to see that. So with those patients, we were kind of like, I don't know, it looks good, you're fine. But now we're starting to see more information. The concern with that longstanding chronic infection is that it can turn into some toxicity, turns into immune reactivity. And now you have a source of infection that is now affecting your whole body's ability to heal, your whole immune system, your whole energy, right? So that's the big issue with root canals, and why it's so important to respect that bacteria. There are some things that we can do in scenarios that can help people heal or buy time as we're trying to figure out if a tooth needs to come out. Ozone, oxygen therapy, I'll explain that to you in a little bit, can help in scenarios like that. All right, awesome. Hopefully so far all of this is making sense. I'm not just kind of like spitting out a whole bunch of words, talking you guys to death. All right, so on number 4, Hi, Dylan. Um, so on number 4, having a holistic understanding, right? So the term holistic essentially means whole body. Essentially, it's the understanding that the mouth is intimately connected to the rest of the body. I've been alluding to that in the last slide with explaining the mechanism of healing, but holistic is kind of your understanding, right? Your intellectual awareness. So having a holistic understanding helps your dentist to prioritize your health because we're not just looking at the tooth, right? That's how things used to be. You go to the barber shop and the barbers would pull out teeth. They give you some whiskey and then they pull out your tooth. It was just kind of like a thing. Nobody thought about the effects on the whole body. But nowadays we're learning more. We're learning the link between Alzheimer's and gum disease and stroke and cavities and all of those things. And so we're learning that the things that you do in your mouth will have a systemic effect. And the systemic conditions you have will sometimes show evidence in your mouth. I can look at someone's mouth and see evidence of diabetes in their gum health and in the way that they're getting decay. Um, so that's the holistic part of it. So now the biological approach. This stems from a holistic approach, right? So you can have a holistic dentist that maybe hasn't implemented some of the biological techniques, but every biological dentist is holistic because the reason that we're doing this is because we understand the whole body connection. And a biological approach is pretty much the process. Okay, so you're saying, okay, what I do in the mouth affects the rest of the body. Therefore, I'm going to use the least amount of toxic materials and be as conscious as possible about the techniques that I'm doing in the mouth. One very common example is how we're removing amalgam fillings, right? When you're drilling, right? And so there's a controversy. Some people say amalgam is fine in the mouth. It doesn't do anything. It's okay. I personally wouldn't want it in my mouth. But I think one thing that we can agree on the conventional side and on the holistic side is that once you start drilling on these bad boys, it releases a lot of mercury. The EPA, the environmental agency, says that it's a problem. We got a little bit of mercury in the lake, we shut the whole thing down. We don't want you eating fish that has mercury in it. You can't have thermometers that have mercury in it, right? And so there's different rules too that have been put in dental offices when we are disposing of mercury. It's got to be wrapped up and in a container and delivered and shipped out in a certain way in order to keep things safe. So mercury itself has been deemed a toxin. So when we're drilling on it, we're releasing that vapor, and then the patient breathes it in, the practitioner, the assistant, everyone is breathing it in, and it's a problem. And I think that conventional dentistry understands or gets this or agrees with this as well. The biological approach is to implement a technique in which we can keep the patient and ourselves safe while we're doing this procedure. And in addition, when we are replacing these fillings that have gaps and they're getting decay and the teeth are broken and all of that, when we're doing that, we're selecting materials that are more biocompatible, right? So typically, these are going to be resins or porcelain-based restorations, inlays, onlays, fillings. But in that same family, that gets us away from the metals as well, not just the mercury. There's a growing number of people, mainly women, that have nickel allergy, and it can be pretty severe. And so there's nickel in all of these metal alloys. It's everywhere. So avoiding that is good. And then there's galvanic issues that happen when you've got metals together, especially dissimilar metals. I see a lot of times there's an amalgam filling and then there's a base metal crown on top. And those two metals, they create like an electrical charge in the mouth. And for some people, that can have really severe symptoms. Um, Another approach is, replacing acrylic with something that's more thermoplastic. Replacing fluoride with all those things that I talked about in the slides before, nutritional changes, using ozone oxygen therapy, ozonated olive oil, using different things instead of the fluoride. And then no BPA, right? There are a lot of filling materials that have a lot of BPA or any of those components that precede the BPA. Being aware of that. And we do have options that are BPA free for filling material. Even in implantology, 15 years ago, we really didn't have any strong options for metal-free implants. You needed to replace a tooth, then it had to be titanium. At that time, they were saying that titanium was, pure titanium. Right now, I don't know any titanium implants that are pure. I think that they're all alloys, which means they've got trace amounts of other metals in there, nickel being one of them, aluminum being the other. So now we've got the ability to replace teeth, and I'm talking a tooth that's completely gone, replace it with a metal-free implant, a material that's called zirconia that is metal-free. And that has been shown time and time again to be more biocompatible and superior when it comes to tissue healing around it. Right? So those are examples in which we are using materials that are more friendly to the system, right? And that's essentially what the biological dentistry part is about. Right. And then you hear the term integrative. So for me, integrative essentially means it could be two categories. One is the providers. So for me, it's important to have an integrative approach in which I can't know everything and I can't pretend to know everything, right? But I work to build a network of practitioners around me because, like I said, if you're having things going on in your teeth and your mouth, you're likely having some other things going on too, right? So maybe you've got some gut issues, right? So I can help you with the dental stuff, but I want to also help you find that connection because you're not going to heal just because I take your amalgam out. It doesn't work that way, unfortunately, because maybe the amalgam's out, but what about the trace metals or trace elements of whatever that's in your bloodstream that maybe now you need to detox from? So it's not just, oh, it's out, your teeth look great, and suddenly you're healthy again. There are a lot of mechanisms now that we need to address and get healing going, right? So having that trusted network of practitioners, maybe you've got some Lyme issues, and there's, that you need some chelation therapy or something like that. There's physicians out there, naturopaths that can help us do some testing, chiropractors, muscle testing, nutritionists that are going to say, hey, we're noticing XYZ going on with your teeth. Let's figure out what's going on. Are you not absorbing calcium or vitamin D or whatever have you? So that's important. It doesn't just end when you get your cavity taken care of or your silver fillings replaced or whatever have you. And then integrative also to me includes alternative therapies, right? Integrating the conventional things like, doing a cavity, doing a filling, integrating that with some non-conventional therapies, right? So maybe it's as simple as homeopathy. After a restoration is done, someone can't tolerate ibuprofen. Okay, well, let's use arnica. That's more, it's less harsh on the system. Or after an extraction, we take out a tooth, we can do some red light therapy on there or some pulse EMF therapy as well. That also includes material testing. In biological dentistry, we're aiming for more biocompatible materials, but for some people, they have heightened sensitivities. They're super sensitive to different materials or even foods. And then we'll go one step further and actually do material testing. So we'll say, okay, of this group of biocompatible materials, your body likes this one. So we'll use this one because it's going to increase our chances of success, right? So those are some things that we can do. And ozone oxygen therapy is one that's becoming, it's really, really catching on. I've even got some colleagues in my study group that are showing interest in one endodontist that's using it. So essentially what the ozone oxygen therapy is. So ozone is essentially made from oxygen, right? As you can see here on the slide, instead of O2, it's O3. It really is that simple. So wherever you have oxygen, you have the capacity to create ozone, assuming there's a certain type of energy that's emitted. So the most common examples of ozone in nature are right after a thunderstorm, lightning, right? That smell that you smell, that's ozone. What the earth does is essentially it creates the ozone in order to cleanse itself, to clean itself. pollutants in the air get cleaned out with ozone. So you smell that after lightning because that lightning gives energy. That energy converts the O2 to O3, and the earth gives itself a little sponge bath, right? Also, when you first wake up in the morning, you got dew on the grass, the sun is just peeking out, and you smell, that's ozone again. So energy from the sun, so we need a lot more lightning. No. So for energy from the sun comes out early in the morning, and that energy converts O2 to O3, and we get that cleansing effect again. So a lot of people relate the ozone with kind of like smog. If you lived in LA for a while, like I did, it was like, oh, today's smog warning is, super high or whatever. And so then it becomes difficult to really understand, like, is ozone bad? But what's happening in that scenario is there's so many different pollutants, nitrogen oxides and sulfur compounds and things like that, those gases that are in the air that we shouldn't be breathing. There's so many different ones that we can't measure them all, right? But the only available constant is ozone, because there's a direct relationship between the amount of ozone that will be created. There's a relationship between that and the amount of pollutants, right? So it's just easier to just measure the ozone. And so that's what that is. And then we've got ozone in our stratospheric layer that helps block the UV light as well. But long story short, ozone is naturally occurring. And we can use ozone oxygen therapy a lot in dentistry to help kill pathogens. It is super, super good at killing pathogens, bacteria, viruses, etc. And it does so stronger than chlorine or any of that stuff. And it does so without any of the harmful residues, right? So, because when ozone works, its byproduct is oxygen, right? So how awesome is that? You use ozone, you kill bacteria, and they are left with oxygen, which is going to reinvigorate the cells and promote healing. So ozone oxygen therapy is one of my favorite things in dentistry. It allows us to give that body the extra little push it needs to initiate its own healing processes. Really, really neat stuff. And this is a topic that I presented at my study club just last week. And I can talk to you guys about this for a while. So let me know. We can probably do a part 2, and then I can talk to you about the different ways that we can use ozone oxygen therapy. I talked to you a little bit a few minutes ago about regenerative endodontics. When the decay is really deep, how do we encourage the pulp tissue to heal on its own so we don't need that root canal therapy? Ozone oxygen can help with that. We can use it, even you can make an ointment, ozonated olive oil, and you use it the same way you use antiseptic or like bacitracin or neosporin, right? But then you don't have to worry about any allergies. And it's an antiseptic, cuts, burns, and all of that. I've used it for my kids so many times. So ozone is a big passion for me. Let me know if you guys want to learn more about that. All right. So number 7, clinical safety. So you can see here 3 different things going on. Firstly, we've got the radiology, the radiographs on the left. So this is a touchy subject because I've got so many people who are like, I don't want to take an x-ray. Please don't make me take an x-ray. And I get it. It's a necessary evil. I need to see what's going on. I don't want to give less than the standard of care. But at the same time, I want to respect that you don't know someone's journey, right? A lot of people's rebuttal is like, oh, whatever. It's not a lot of radiation. It's the same as a flight from here to Milwaukee or Chicago. Yeah, fine. It's not a lot. Yes, but it's all cumulative. And what if that person's had a lot of radiation recently, right? Or what if they fly a lot? They got to get on an airplane all the time. Or what if they don't do any of that and they just don't want the radiation? Like, I respect that. And so, at least for me in my office, a lot of care and time went into finding the equipment that, one, is digital. Like this day and age, I know I try not to be super polarizing, but this day and age, radiology should be digital. It emits just a fraction of the amount of radiation that used to be when we did film and then we dipped it and developed it and all of that. But even within that digital radiology, picking equipment that's high quality. I was telling someone from the Holistic Moms group how I spent so many months shopping around for the CBCT machine because I really, really wanted one that had the lowest radiation emission on the market, and a really quick scan time. So for me, that green CT machine, it, it checked off those boxes. So that's one of the ways that I can clinically try to keep myself and my patients safe. The other one is what's in the middle there, and that's essentially an air filter, clean air filtration. So when you go inside the dental office, we're constantly drilling on stuff, whether that's in the mouth or in the lab. Stuff is in the air all the time. And so one of the things that I think is beneficial is to have a way to filter all that air out. Yes, for the patients that come in and you don't like, it's like when you go to the nail salon, I can hardly handle it anymore because I'm there like 5 minutes and then my brain starts to think about all the toxins that I'm inhaling. I mean, the dental office is not that bad, but at the same time, it's that same concept, and it's about keeping the patient safe, but also myself and my team, right? I want to be able to do this a nice long time. And I've met practitioners who have had some lung issues because of this very thing, because they sit in a lab and they're drilling on acrylic and they're just inhaling it. So air quality is important to kind of be aware of. And one of the ways that your biological dentist is keeping you healthy is by having air filtration in the office, right? And that same air filtration is used during the smart amalgam removal protocol. And so this is probably one of the more common things that people have sought me out for. The IOMT, which I mentioned at the beginning of the presentation, has put together a protocol that helps us to remove, when necessary, those amalgam fillings safely, right? Because you drill on the amalgam, you release the mercury and all of that. And there's different types of equipment, as you can see on the image. The practitioners have on protective things. The patients are covered up protectively. That big white tube on the right side of the screen, kind of over the patient, is that same air filtration arm, suctioning everything else that the high volume suctions miss, so that there is just the tiniest, there's just no doubt that you've gotten as much as that of that mercury vapor away from the patient as possible. All right. Okay, so now we are nearing the end here. I hope that was helpful. This is a good time for me to answer any questions if you guys have any, or any feedback or any of that jazz. Yeah, Tracy, that is a really neat idea with the ozone, if that's what you were referring to. It's really neat. All right, so I'll give you guys another minute here and see if there are any questions. And then too, let me know in the chat box what other topics. I understand Erin wants to discuss more ozone next time. And I've given these seminars in person before, and that's always really fun. I love the personal touch, but sometimes it's nice to just kind of sit in your home, not have to, especially on a day like today. Oh my gosh, I can't imagine people trying to like leave work and then come meet at Good Harvest or something for a seminar. And you don't have to worry about who's going to have to suffer with your kids while you're doing whatever. So hopefully this webinar setting works and we can do this again. You are welcome, Erin. All right, you guys, I am going to log off. You are welcome, Lucy. Thank you, Jill. Thank you, Jill. Thanks, Marcus. Who else? And Tracy and Amber and Corey. You guys are fantastic. Jenny, Laura. Thank you guys so much for all your support and everyone that's typing in. Yeah, so keep me posted. You can always email me here at the hello@bionicadentalwellness.com. I forgot the .com, but email me if you have any questions. You guys have a wonderful night. Thank you so much for your time.